Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. And in this installment, this is going to be part 2 of Catatonia, in which we will be going over the diagnosis and treatment of catatonia. Before we begin, let me just remind you to please watch the full video, because throughout the video there will be 3 key words. When I get to the keyword, I will say keyword, then what that keyword is. At the end of the video, in the comments section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. So how is catatonia diagnosed? Well, there is no definitive test for catatonia. To diagnose catatonia, a physical exam and testing must first rule out other conditions. The Bush-Francis Catatonia Rating Scale, better known as BFCRS, is a test often used to diagnose catatonia. The scale has 23 items scored from 0 to 3. A 0 rating means the symptoms are absent. A 3 rating means the symptoms are present. Blood tests can help rule out any electrolyte imbalances, because these can cause changes in mental function. A pulmonary embolism or blood clot in the lungs can lead to catatonia symptoms. A fibrin D-dimer blood test can also be useful. Recent studies indicate that a catatonia is associated with elevated D-dimer levels. However, many conditions such as pulmonary embolism may affect the D-dimer levels. So a CT or an MRI scan also allows the doctor to view the brain. This helps to rule out any brain tumors or swelling. So that's how it's diagnosed. As you can see, it's more or less, an elimination process. So once they eliminate everything and they determine that you do have catatonia, then comes how is it treated? Well, medications or keyword electroconvulsive therapy may be used to treat catatonia. Keyword medications are usually the first approach to treating catatonia. Types of drugs that may be prescribed include benzodiazepines, muscle relaxants, and in some cases, tricyclic antidepressants. Now, benzodiazepines are usually the first medications prescribed, and that is because the benzodiazepines include Klonopin, Ativan, and Valium. They increase the GABA in the brain, which supports the theory that reduced GABA levels leads to catatonia. People with high rankings on the BFCRS usually respond well to benzodiazepine treatments. Other specific medications that may be prescribed based on individual cases may include aminobarbiturate, which is a barbiturate, bromocriptine, better known as cyclazate, and Polidol, carbitrol, epitrol, and tegatol, lithium, thyroid hormone, and zolpidem, which is also known as Ambien. After 5 days, if there is no response to the medication or if symptoms worsen, a doctor may recommend other treatments. Now, so let's go over what electroconvulsive therapy is, since that was mentioned as a second treatment. Well, electroconvulsive therapy is an effective treatment for catatonia. This therapy is performed in a hospital under medical supervision. It's a painless procedure. Once a person is sedated, a special machine delivers an electric shock to the brain. This induces a seizure in the brain for a period of around a minute. The seizure is believed to cause changes in the amount of GAMA, and that's what that is used for. So what is the outlook then for catatonia? Well, people typically respond quickly to catatonia treatments. If the person doesn't respond to prescribed medications, a doctor may prescribe alternative medications until symptoms subside. So some people who undergo ECT have a high relapse rate for catatonia. Symptoms usually appear again within a year. So can it be prevented? Well, because the exact cause of catatonia is often unknown, prevention isn't possible. However, people with catatonia should avoid taking excess, keyword, neuroleptic medications, such as chlorpromazine. Medication misuse may aggravate catatonia symptoms. So that is how it is treated. And as you can see here, it affects the motor, your motor functions. It gives you extreme negativism, and you can become mute. So it is a very serious mental illness, and it is part of sometimes found in other mental illnesses, such like in autism, schizophrenia, but alone as a catatonia disease, these are some of the things you need to look for. I hope this lesson has helped you and guided you to give you a better understanding, because there's a lot of different mental illnesses out there, and we are not, what I'm doing is not even going to cover a tenth of them. But the main reason why I'm doing this is to help everybody to learn to see with your heart more and not your eyes. Because when we judge somebody by the eye, we judge wrongly. Just for an instance, I'm just going to use an example. We know that a lot of people on heavy drugs, when they, are on it, they will scratch like they got something crawling on. Well, believe it or not, if you just look at somebody, you see that, you automatically judging them, saying that they're on drugs. But what you don't know is they may not even be on drugs. They may not touch any drugs. They may have a mental illness. And if you look back into mine, there is a mental illness that mainly females get for some reason, where they think that they have parasites on them. Okay? So that's a good example of why we shouldn't be judging with our eyes, and we need to judge with our heart. Because we could be judging wrongly, and that person may need help, and you're automatically accusing them of being someone on drugs when it may not be that, or any other thing. When we're nice and we uplift, especially now, we're in such a trying time right now. Our world is falling apart. Our economy has been shattered, all from this one virus. Yes, we have to keep our social distancing. But this is also a time when there's going to be more depression out there, more than normal, more suicides. I mean, our economy is falling apart because everything has to be shut down. So there's people without jobs. So stress levels are going up. Anxiety levels